Florida has fallen behind the rest of the nation in the use of advanced practice nurses. Florida is facing rising healthcare costs, a shortage of health providers, and increasing numbers of elderly and uninsured individuals. Outdated state practice acts and insurance regulations prohibit Florida's advanced registered nurse practitioners from practicing the full scope of their role, thereby perpetuating Florida's healthcare crisis.
Advanced practice nursing has been part of a long tradition at Orlando Health. I've been here 25 years. And initially, we didn't have a lot of advanced practice nurses around. Now we have many, many advanced practice nurses. In our physician practice at MD Anderson alone, we have 15, and we're looking for more.
There are over 13,000 advanced registered nurse practitioners in Florida. ARNPs have advanced clinical training, a minimum of a master's degree, and national certification in their specialty.
My name is Melanie Reese. I'm a certified nurse midwife, and I've been a nurse midwife now for 10 years.
Well, here the midwives are intimately involved in our faculty practice.
They do things differently than OBGYNs do. They have a different way of looking at deliveries, of labors.
Midwives I've worked with have diagnosed thyroid cancer. I don't know how many gynecologists anymore even would find thyroid nodules because we're fixated at time-wise, just get people in, do a breast exam, pelvic exam, thank you, bye, and then we have to move on.
We have time in most instances to really talk to the patient, really get that history from them. And so sometimes you can pick up things that are going on with the patient, have an early diagnosis, and do some early prevention. You work with the moms, you get to know them beforehand, and then when you do the delivery with them, you know what they want, and so you try to make the delivery special for them.
With a midwife, just because everything went so calmly and smoothly, I just think that my healing process, because I feel so good about myself afterwards, that it will go so much faster.
I specifically wanted to be a nurse because I wanted to be with the patient the entire time. As a nurse anesthetist, I'm with the patient from the minute that I talk to the patient till the patient wakes up. So it's very gratifying to me to take care of the patient continuously during the time that I'm with them.
This community in Sebring is out in a pretty rural area. You certainly, as you can see, have to drive miles through cow pastures and orange groves to get there. With anesthesia provider shortages, my driving the 90 miles helps them to get the care that they might not be able to get if I didn't make that drive. In just a couple minutes, I'm going to have one of the staff come and take you back to the procedure room. We'll get you hooked up to the monitor so I can watch your blood pressure, your heartbeat, and how well you're breathing. Before Dr. Wittenborn wants to numb everything up with the Novocaine, I'm going to put some medicine in the IV and you're going to miss that part entirely. You're just going to kind of snooze for a moment. I'll be with you the whole time. Make sure that you stay safe and comfortable. I think the nursing background that I have is critical to what I do, and I'm very proud of that. I think that it's what I hope sets my care apart.
What we do, I think, that's unique is we look at a person as a whole person. We see them not just as a patient, we see them not just as a disease, we see them not just as a name on the schedule. And you treat the patient, you treat the family, you treat potential diseases. You don't just look at the reason the patient came into the office that day.
For one thing, we do allow ourselves time with our patients. I've had patients tell me when I'm doing a physical, they've never had a physical like that before. They've never had anything so thorough, and they've had physicals for years.
When I come down to Judeo-Christian Clinic, this is where I give back to my community. Here, as a volunteer since 1985, I'm able to help people who just can't afford medical health care.
Access to health care is what this clinic is all about. And the problem that these patients are facing is they don't have access to health care. And so the more that we can open those doors for them, the better off our entire country is going to be and the entire healthcare system. So I think we're seeing that more and more, where offices are turning to nurse practitioners to open those doors.
I'm Cindy Drew. I'm a geriatric nurse practitioner. I take care of geriatric patients in various settings, including nursing homes, assisted living facilities, and I even go to the homes.
Good morning.
Hi, Mr. Sokovic. How are you?
Oh, good. You're looking good.
I'm doing good. One thing that I think is an important part of my job is keeping people out of the emergency room. Older person doesn't do that well in the hospital. If I can treat a patient with maybe a fluid and electrolyte imbalance, it's going to be a lot less expensive than if they have to go to the hospital.
ARNPs focus on the prevention of disease complications and therefore reduce unnecessary emergency room visits, hospitalizations, and uncontrolled chronic illnesses.
One of the challenges related to seeing children with attention deficit hyperactivity disorder is that many times the medications that are used to manage them are controlled substances. And in the state of Florida, nurse practitioners are prohibited from prescribing controlled substances. So each time I see a patient who might need a controlled substance prescription, I can see the patient for the initial evaluation, do the complete physical examination, the complete neurological examination, formulate a diagnosis, develop what I think is the best treatment plan, but I can't write that prescription to implement that treatment plan.
I have to work with a lot of patients who have cancer, have terminal illness. They may have chronic pain, and I'm not able to prescribe the medications that are necessary. They have to wait until I find a physician and get some pain medication. I don't think they should have to wait at all to have their pain controlled when they're at the end of life.
And you said you needed a note for the assisted living facility to let you have your
And
supplements.
they will not accept just your signature. Well, I was under the impression that her signature was all I needed. That was my choice of a medical professional to help me with my medical problems. And then I find out that they don't even want to accept her. And that's the cause for my good health. And I think at 85, I'm doing pretty good.
Being able to maximize the dollars that we spend from the state as well as from the insurance companies will help to minimize the overall burden on healthcare and perhaps allow more patients to be able to access the care necessary.
There are many third-party payers, that is insurance companies, who don't recognize nurse practitioners as legitimate providers of health care. So working with the insurance companies to have them recognize nurse practitioners as legitimate providers of health care would be tremendous.
By removing these barriers to care, the Florida legislature is poised to join the rest of the nation in utilizing advanced practice nurses to their fullest capability.
We're not eliminating advanced practice nurses. We're adding them, and we're adding them every single year. Our big challenge is you can't find enough of them, and you can't find them quick enough.
In order to improve Florida's healthcare system, ARNPs need the authority to prescribe all medications, including controlled substances, be included in the Florida Insurance Act as health providers, and be included in payer panels including Medicaid managed care. With legislative action, advanced registered nurse practitioners will provide much needed solutions to Florida's healthcare crisis.